Where physicians work is a big issue for us. Here in Pennsylvania, we estimate that about 70% of all our Pennsylvania physicians are in employed settings, meaning they work for a hospital, a health system, or a large group. And so the days of driving by and seeing a physician with the shingle out in front of their office as an independent practitioner, in many ways are numbered. And what that's done is change the physician in terms of how they work, where they work. They're no longer potentially as concerned with those things about running the business, and have sort of delegated that to their employer, if you will. What we've tried to do is really think through with those physicians, what do you need from the medical society? As employed physicians, what are your advocacy issues? What are the ways that you want to learn about patient care? What are the things you need to know about working in a system versus being an independent business person? And we've seen a pretty significant shift, and my guess is we'll see that continue to grow, where maybe 90% of our physicians are in employed settings in Pennsylvania in 5 years. Some new data came out that showed that Pennsylvania does well in terms of the number of physicians that we train. We have 9 medical schools in the Commonwealth. It's a fantastic resource. But what we haven't done well is keep those physicians in Pennsylvania when they're done with their residency programs. One of the things we're trying to do is give more opportunity to more medical students to do primary care residencies in the state, and especially incentivize them to move to places where we know we need primary care physicians in the state. There are 2 parts of the Healthy Pennsylvania plan that I think are really important to keeping physicians in the state, keeping young physicians in the state. There is a loan forgiveness provision that seeks to work with the legislator to appropriate funding to develop a new loan repayment program for new physicians, especially in primary care and especially if they practice in underserved areas. And then there's also a residency program expansion where we're looking for new dollars to expand the residency slots available to medical students in the state.